Dr. Engel, I'm so excited you're here.
Yes, thank you.
Thank you for joining us. We have a lot of very excited ladies that want to talk to you. But before we do, I want to introduce you, give you a proper introduction. Everybody, this is
Sure.
Dr. Engel. He is a best-selling author. He is a graduate of Sherman College of Chiropractic and has a Bachelor of Science from Virginia Tech. He's a practicing upper cervical chiro for over a decade now. He's been featured on Fox TV, Fox Radio, and on ESPN. That's an interesting story. I would imagine it's about athletes, right? Talking to them about adjusting
Concussion, that kind of stuff. Yeah.
Yeah. And then he has his own practice here in Fort Myers. And that's how I know Dr. Engel, because when I moved to Fort Myers, I had to find upper cervical because me, and most ladies know my story about my migraines, right? Because I talk about it all the time. But when I found you, I was just like, I was so grateful. And so I'm so glad you decided to join us today because we have a lot of questions for you. And also you have quite a story. Like you have had some pretty traumatic health issues with you. So do you want to maybe talk about that a little bit and then we'll, ask some questions?
Sure. And hello, ladies. Thanks for having me.
Yeah.
We'll fast forward and maybe I'll back up a little. When I was 30 years old, it took me literally 5-10 minutes to get out of bed. I couldn't put any weight on my right foot. I had to be on crutches for about the first hour of the day. Both of my hands would go numb at night, and they were either numb or they felt like somebody had set them on fire. My left hand was numb, fire, or tingling 24 hours a day. I had terrible neck and back pain, sciatica, digestive problems. I had incontinence problems, and my brain had just about stopped working. I couldn't keep I would always been highly motivated and overachiever. I'd gotten to the point where I just worked just enough to survive, be able to put $5 of gas in my car and hope that I had $5 later. I just had no motivation. I was depressed, anxiety. I had developed horrible OCD. I couldn't use a toothbrush more than once. I had to count my steps in a room. I just felt like my health had stolen my whole world and was falling apart. And that's when I'd gone to chiropractors for years. I don't really know why. The idea of it made sense to me. The philosophy made sense, but in practice, it had done nothing for me. But I kept going because you keep trying, right?
Right.
That's when I found someone who adjusted the top bone of my neck. And within, I talk about it in my book, but within 4 months, I was like a different person, but I had a new brain, a new body, like everything functioned like it should. I'll be 47 next week. And I'm infinitely better than I was then. I always morbidly joked that by the time I was 50, I'd either be in a mental institution or in a wheelchair, and maybe I'd be rolling around the mental institution in the wheelchair. But it was,
my God.
Life altering.
So did your that poor health condition, and then when you started getting adjustments, did that prompt you to go to school to become an upper cervical chiropractor?
I had gone already. So my life was terrible, right? I had nothing. So somehow I decided the cure for this must be to go back to school.
Okay.
So I went to chiropractic school, and I think the idea of it made sense to me. So that's what I did. And it was in the first year of school, which I almost failed out of because, again, I could not think. Right. I had horrible brain fog. I couldn't remember anything I read. And we had a class on upper cervical, and I went and asked, and it made sense. And I went and asked the man who taught it, he had a little office in town. If he took students as patients, and I went and started seeing him, and everything changed.
Yeah, that's amazing. And so, the question I want to ask you is, a lot of the women here need an explanation of, and I get this question a lot, and I want you to, articulately explain it, because they'll ask me, well, I go to a chiropractor. So what's the difference between a standard chiropractor, which adjusts your spine, and also we want to talk about how they adjust the neck too, versus just an upper cervical? What's the difference, and why is it important to know the difference?
So what makes it important to start with is how important the upper part of the neck is, right? I'm not saying the entire spine is important, right? You fracture a vertebrae anyway, we have a problem. But when it comes to general health and general function, whether that be internal, skeletal, whatever it is, the very top of the neck, right up here, kind of under the ears here, is the most vital part of the whole thing. So from a structural standpoint, I always say it's like you got a bowling ball and a stick. If my bowling ball is sitting straight on there, I can hold my stick straight and I'm pretty good. If my bowling ball starts to roll off, that stick's going to have to bend and turn. I'm going to have to put a lot more tension on that stick if I'm going to keep the bowling ball up straight. And the bowling balls are head, of course, right? So if this thing is rotated and tipped and turned, the hips, the upper back, the legs, whatever it may be, that's why I had that terrible ankle pain that had me on the crutches, because I had such imbalance in my spine. And then if you go more toward, and really, I mean, not that that stuff can't be debilitating, but much more internal, the brain, how the hormone works, how everything functions. We've got the brain in our head, right? The brain decided I was going to put this shirt on today, my shoes, whatever it was. But then you have the brain stem, which is kind of the tail end of the brain. It comes down in the top two bones of the neck. So the brain stem kind of sits here. It's really the thing that controls how our body functions. It does all of the autonomic stuff, the autonomic meaning automatic, all the things we don't think about, right? If we eat, we digest food, if we do hormones, insulin, whatever the thing is we're trying to do, that's really the control center for all of that. So if we get a misalignment up there and we put pressure on the control center, anything in the body above or below can kind of go haywire and misfire. And that's really, from a philosophical standpoint, why that area is so vital. If you go into more of a structural standpoint, I got a little bone here. Normally, when we think of vertebrae, we got two blocks of bone with a disc in the middle, right? Talk about disc herniations, disc degeneration, whatever. From the third bone in the neck down to the bottom of the spine, it's made like this. So with that disc in between there, not like these can't misalign, but they're somewhat glued in there. And if it's going to misalign, it's going to go back in one way or back in the other. If I've got a 50-50 shot in an education, that's pretty easy to figure out what I need to adjust or how. But the top two bones in the neck are very different. We have way more range of motion in our neck than we do, say, our mid-back. So they're the one place that doesn't have a disc in between them, and they have really flat joints so they can slip and slide and move. So rather than a two-dimensional misalignment, back and left, back and right, now we've got a much more three-dimensional misalignment. If I have a three-dimensional, much more complex misalignment, I have to be far, far more specific in my analysis of how that's misaligned. And again, if I'm surrounding the brainstem, I want to be very careful, right? Precise. And then the adjustment itself has to be much, much more specific. It's not this twist, turn, pop, crack thing that people think of. And you know, Terry can comment. It's, you barely even feel like anything happened, but it's really, really precise.
Yeah, it's crazy when I learned that the atlas and the axis, which I'll have you talk about next a little bit. But before I do that, ladies, I want to let you know that if you want to ask a question to Dr. Engel, I want you to type in the chat box your question. If you want to actually be live and come on live and ask him a question live, you can raise your virtual hand and I'll bring you on. You can actually talk to Dr. Engel. But if you just have a question, please type it in the chat box and we'll get around to it sometime in this presentation. So Dr. Engel, I want to, because I think it was you that gave, maybe it was you, or it might have been Dr. Hillpush when I was in Minnesota, but they gave me the visual that those two bones, it's called the atlas and the axis. The atlas is the C1.
Yep.
And then the axis is a C2, right?
Yeah, because Atlas, right, from mythology, held up the world.
Oh,
so your atlas is holding up your world, the brain.
Oh my gosh, that's a great way to look at it. Yeah.
And then the axis, right, that's what something pivots around, and we basically pivot our world around the axis.
Oh my gosh, you guys, that's amazing. That's an amazing way to look at it. Yeah. Okay, so that will help me remember. So the atlas and the axis, right, our bowling ball at the top of the head. But what was really interesting to me to visualize was that when that atlas and the axis, right, our brain stem goes through that, right?
Yep.
And tell me, all the nerves, what in the brain stem, that all those nerves are what's basically making our bodies operate.
Everything.
Not only physically, but
yeah, it's a master control center of everything.
Yeah. So when these are off, meaning if they're off any little bit, it pinches that brainstem, right? It like pinches some of it.
Yeah, it closes down. Yeah.
So that can't be good.
It's not good.
That's what I'm saying. It's like, I mean,
no, you get nerve pressure. You start to alter blood flow to the brainstem, to the brain, blood draining back down, and you cause a big mess.
So why, like, that's my question, I guess, then is, I mean, I can't imagine everybody has perfect alignment in their atlas and their axis. There's no way. So some of the common symptoms you see from a misaligned atlas and axis are what?
I mean, certainly headaches like you. I get tons of vestibular balance issues, tons of chronic pain, fibromyalgia. I get a lot of MS patients.
So MS, you said multiple sclerosis?
Yeah.
Wow.
Yeah, there's been a ton of research done in Italy and a little bit in this country, but a ton on there on upper cervical and MS.
Yeah. And what other major like symptoms are?
Digestive problems, menstrual issues. I mean, there's almost no end to the list of, I mean, if you mess with the thing that controls everything, then almost anything can go wrong.
Yeah. So when you talk about when those two adjustments are off, when those two are off, and you get all of these issues within the body, and you go to your normal chiropractor and they want to do a neck adjustment, tell us what's the difference between your neck adjustment and a regular chiropractor's neck adjustment. So we left off at when you're going to a regular chiropractor, right? And they do the neck adjustment where you're laying in the bed and they crack it and it's really loud in the ears, versus your technique, which is just very subtle. Talk about the difference.
Well, if you're going to be subtle and specific, it really all starts with very specific imaging, right? There's tons of little minutia to the angles and degrees that can misalign. I'm going to figure that out. I need very, very specific imaging so you can figure out exactly how that thing is misaligned. It's difficult with something that's that small and that freely movable to really accurately feel it and say, well, I think it's going here and there. How about we find out it's going exactly this way, this many degrees. Somebody's joint angle might be 20 and somebody's might be 40. If I'm trying to make the same adjustment, somebody's joint's going to get jammed, so to speak, and you're going to have to almost kind of force it in there. I always compare it to, if you take a key that's been really roughly cut and I kind of bang around, I can eventually get it in the lock and jam it in there and torque it and maybe get it to go. But if my key is perfectly laser cut where let's slide in and turn, it doesn't really require any force, right? It just slips right in. It's very fluid and smooth.
Yeah. Yeah. I love that, because what I like about upper cervical, one is that, like you said, when you go in for your assessment, you actually measure like where it's off and how it's off, and you only adjust to that. Whereas when I've gone to other chiropractors, like regular, not upper cervical, and you lay on that bench and they crack it, and it kind of hurts, actually. For one thing, it does hurt. Yours don't hurt. The upper cervicals don't hurt, but the ones that I've had before, they hurt, and I don't like that sound. And I feel like it's not. I feel like they could be doing more damage versus. I mean, talk about that. I don't want to,
I mean, possibly yes, but I think the bigger picture is it's easy for me to make some noise in there, but am I really seating things back and taking that pressure off? That's the ultimate key. Making some noise might feel good or sound good, but am I really releasing that pressure off the brainstem and doing the job that's really important?
What are some of the main, like I'd say the top main injuries that you've seen, and how do I guess the question is, how do they become misaligned? What are some of the key things that make those axis and axle go out of alignment?
I mean, there's tons of people who've been in a car accident. Now, when I say, have you ever been in a car accident, people think, well, was I hospitalized or I break something? It doesn't necessarily take that, right? If you were standing somewhere and I came up behind you and just gave you a quick little shove, you think about how much of a jam that is on the neck. Even minor accidents can cause significant issues in there. Maybe you tripped and fell. Maybe as a kid you were learning to walk and you fall and hit your head on something. People get thrown off of horses. I mean, it's hard to get through life, and especially the older we get, without having some sort of knock, bang, something that injured us maybe a little bit. Because if we have that freely movable of a system with a bit, so we got a heavy head, 10, 12-pound head on top of a 2-ounce bone without big locking mechanisms so that it can move more, it doesn't take that much to whip it a little bit and create a problem.
And so they never can go, like, let's say you've gotten into a car accident and those go out of alignment. They can't just go back naturally in alignment, right?
I mean, there's times I guess they can, but often it's more of a case of it got stuck and your body, for lack of a better phrase, can't unstick it.
Right.
It gets jammed off the track and then you got to get it back on track.
And then the longer it stays out of alignment, the more can end up going out of alignment. And the more you keep putting pressure and compression on that, on the brainstem, That's what
You do
freaked me.
that.
That's what freaked me out. Like when I learned
Yeah, you
that,
do
like,
that. The whole spine starts to tighten, and generally, problems will start to develop other areas.
yeah. So why is it that, and I think you told me this, why is it that when you go to a regular chiropractor and you have a subluxation in your spine, let's say, your lower back is out, and you go there and you get some relief, why is it that it always goes back out of alignment? I was told, I think it was by you, that if your C1 and C2, your atlas and your axis, are out of alignment, you can get as many adjustments in the world that you want on your lower back and they'll never stay. Is that correct?
Well, that was certainly my experience. I went to chiropractors for years and had horrific leg and low back pain. But if your body's a balancing act, right? If the head is crooked and the shoulder drops and a hip comes up and twists, and all of that is in an effort to keep the head level because that top bone is off, it doesn't matter how many times I go down low and push and tug and pop and crack until I level the head back out, everything else can't sort of straighten itself out and stay put where it's supposed to be. Your brain will take care of itself first. If that means it's going to beat up your lower back, then so be it. But it will still defend itself first, and it wants to be level.
Yeah. And what about like some physiological things that you've seen from your C1 and C2 being out of alignment? Like physiological, like I'm talking disease wise, like you said, MS was one. What are some other chronic diseases that are kind of related to having out of alignment?
I mean, you see tons of GI issues of all different sorts. IBS,
GI, isn't that interesting?
Yeah,
Explain
tons
that.
of that.
Let's talk about
Tons
that for
of
a little bit.
autoimmune issues. I mean, a body that's not functioning right and has stress, so to speak, put on it, and high levels of inflammation, which is what happens. You get high cortisol levels, which will interfere with insulin levels and beats it up. Things start to get inflamed and they break down.
Talk a little bit more. Let's go in a little bit more detail, and then we'll take some questions. But let's go in a little bit more detail about like how does your gut, like IBS, digestion, how does that impact? Because I've said this before in a lot of my coaching calls, and they just don't believe me. They're just like, how can having your neck out of alignment have anything to do with your digestion? Can you speak on that?
So you have something called the gut-brain axis. You look that up, there's all going to be all kinds of stuff, technical words, right? But it's the response. I mean, the gut's even been called the second brain at times. So the brain and the gut are highly, highly intertwined. If you have, let's say you have a head injury, so to speak, right? And you get an inflamed brain from that, there's no chance you're going to have an inflamed brain without an inflamed gut, and vice versa. An inflamed gut will give you an inflamed brain. But they're so tightly linked together, and they're linked together largely by something called the vagus nerve. But if that vagus nerve isn't functioning properly and it orients and starts in the brainstem, so if I get pressure on that nerve that travels to the intestines, it travels to the GI system, it's going to start to not function right. And like I said, if you have pressure up there, so I'll say this. So our nervous system has two halves. It has fight or flight. It has rest or digest. Now, during the day, we're on this call. They're both working at all times. But that fight or flight, now not fight or flight really like I'm running away from a bear, but the more alert state of our body should sort of take over. But let's say it in more of those terms. If I'm running away from a bear, I'm not too worried about digesting my food. I'm not too worried about balancing my hormones. I'm not too worried about healing. I'm worried about getting away from the bear, right? So if I'm always more elevated in fight or flight, which is generally what happens if I get pressure on the brainstem, I've lost what? I've lost rest or digest. So I'm not going to digest as well. I'm not going to sleep well and heal up at night. I'm not going to replenish hormones. I'm not going to replenish neurotransmitters. And I'm naturally, almost genuinely, because of that, going to have high levels of inflammation. And high levels of inflammation keeps your body from healing. It makes everything hurt. It interferes with digestion. And in general, and then that gut-brain axis just does not function properly.
Yeah, that's perfectly said. Yeah, it's crazy. It's like we have to manage that stress load, right? And like I teach my girls all the time that, stress isn't just emotional stress. Like I've had a bad day, am I yelling at my husband?
Sure.
Stress is also like subluxation in the spine, or, digestion issues, or your upper cervical's out, or you're having high insulin or high blood sugars or pain in the body,
Yeah, it's
or
physiological stress,
right. There's just many
which
different
will
kinds of,
bleed over and at some degrees cause mental stress. But if I'm kind of in fight or flight all the time and I don't sleep well, I'm going to be a little irritable. I'm going to be a little bit cranky, and I'm going to be a little bit wound up, and I'm going to be tired all the time.
right. I bet you see that all the time in your clinic.
Yeah, and as much as you want to try to calm down, as much as you
Yeah.
try to sleep, or you take stuff to sleep, or you think I got to be nicer to everybody today, whatever it is, if you're always ramped up in there, it's just a never-ending fight that's hard to get on the top of.
Yeah. Let's take some questions. Ingrid, can you go ahead and ask Dr. Engel a couple of questions the girls have? Go ahead and.
Sure. So one of the questions is, if you have osteoporosis, is it dangerous to have the upper cervical adjustment done? She's had a bad experience with a chiropractor before, and he actually broke some bones with his treatment.
So, first of all, I'm sorry that you had that terrible of an experience, but no, it's really not. The adjustment is, I mean, you don't even feel anything that happened. It's so precise. It's so quick. I mean, it doesn't, I'm in South Florida. There are tons of older people here, tons of osteoporosis. I've adjusted 99 and 100-year-olds, and I've adjusted 3-day-olds, 2-day-olds actually. So no, there's really not with this type of adjusting. It's so gentle. It's not that forceful jerking that it was.
Yeah, and I'll just come in and kind of edify that. Like, I used to get my neck adjusted with a chiropractor, and I was scared every time I left there. And because I heard that noise and it hurt, until I learned about upper cervical, and exactly I understood it better, right? And you go in there, I'm laying there, and you actually, like, you will measure, you use this device to see, like, if you're like out of alignment, and then you actually take, what's that thing called? Measuring, what's that thing called?
Protractor.
Yeah, protractor. Thank you. And you actually set that on your neck, and you actually measure, and you have your hands adjust. So it's just very, like, you can tell it's very specific. And
it's so precise. It just doesn't require force.
And it doesn't hurt. It does not hurt.
Yeah.
You actually, you guys, you lay on your side like this, whatever side, he lets you know which side he needs to put you on. You lay on your side, and there's a bench that you lay on, and then like a massage table, they have the headrest. Well, it's kind of like you have this adjustable headrest, and your head's there, and then he uses this protractor in his hands, and then he just takes that headrest, and I don't know, what do? You step on something and make it drop? I don't even know.
No, it's just when you put a little pressure on the neck, it just drops a little, and then that.
That thing just drops, and it's crazy. Like, I'll go there sometimes, and I'll be like, doctor, look at my head. It's just, I know my neck is all right. And he'll adjust me.
Yes.
I'll go rest for 5 or 10 minutes, and I literally walk out of there like, wow, it's relieved. So yeah, it's very different. It's a very different technique than your regular chiropractic technique. What other question, Ingrid, do we have?
Next question is, my husband and I have been going to a popping chiropractor for a long time, but started going to an upper cervical over a year, closer to 2 years ago. I trust it's working for me and my children. Sometimes I can feel the adjustment, but not a lot of times. Is that common? My children and I go 1 or 2 times a month. My husband quit going because he never felt a difference. Again, is this common? Maybe a mindset we need to get out of?
Well, the feel of the adjustment, a lot of times I adjust people, especially the first visit, because there's all this buildup. I do all this testing, I take all these x-rays and all this, and then you do the thing, and then they start almost laughing or looking at you like, are you kidding me? Did you even do anything? But again, it's so precise, it's so light, it's so gentle. Often you don't get that big, like, click or that big pop sound. I mean, most of the time I get adjusted, I don't really feel it. I know I'm better because I trust the person I go to, but no, it's very common that you don't really feel anything. And like you spoke to about the husband, I mean, like anything, right? My success rate is incredibly high. It's higher than anything else I know of, but that doesn't mean 1,000 out of 1,000 people are going to get fantastic results. Sometimes something else is going on, or there's other factors and things that need to be dealt with that will either delay or, that's just not the problem.
Yeah. I mean, I always look at it as, you got to look at your body as a whole, right? You can't it's never just one thing. It's never just like, if you have diabetes, not just because your neck is out, or if you have diabetes, not just because you have high insulin or high blood sugars. I mean, there's a combination of things. And that's how I use upper cervical as a tool, as a tool to use in addition to everything else that we do from holistic perspective, right? But I just find that the upper cervical plays a major role with a lot of neurological things that, like my mom, she had vertigo, right? I shared this with the ladies. Vertigo, it was so scary that she would pass out, vomit, and they thought, and then she'd be rushed to emergency hospital, and they thought she was having a stroke. And all the time it was vertigo. She went and had her first adjustment, and she hasn't had episodes like vertigo for years since she's been using upper cervical. I mean, that's pretty incredible.
Oh, and let me throw in one more thing on that question about once a month or twice. Yeah, I mean, that's a pretty normal maintenance. I like to get checked at least once a month. I don't always need adjusted, but I want to make sure that I'm good, because believe me, I do not want to revert back to where I used to be.
Yeah. Any other questions, Ingrid? Let's just keep kind of going until we.
Yeah. Do you also do the back or only the neck? Do you feel that it's okay to have the chiropractor to adjust the back and not your neck?
Well, I'll answer two parts of that, and I'll answer the second one two ways almost. There are times, yes, that I will adjust down lower. If I've got somebody who sits at a desk 60 hours a week, as great as I get their Atlas and Axis up here, sometimes you need to do a little something else. Or if somebody's had a real direct trauma, they got thrown off a horse and landed on their hip and jammed everything. So there certainly are times maybe that I adjust something else. Answering the second part, is it okay if they adjust your back and not your neck? I mean, I don't think that's bad, and it depends on the neck. There are people that sometimes that come in, some people simply have not had trauma. They've had a nice life where they weren't in a car accident, they didn't fall, maybe they didn't play sports and get banged up, they didn't fall as a kid, and their neck doesn't need it. It's not very many people, and I think if you're not getting the neck properly adjusted, you're missing out on a big thing, right? Because now we're getting back to the idea of chiropractic is for a tight back or a painful back versus chiropractic is for making sure that my body is fully functioning like it should. My nerves are doing what they should. My blood is flowing where it should. My brain is working and everything else is good. So two different sides of the coin there a little bit.
Yeah. Is it true that if you have a severe trauma to the neck and your upper cervical is out, that your lower back, if you are out of alignment there, it won't even stay in alignment unless you get the top two in aligned?
Usually it won't. No, it'll just keep popping right back out.
Yeah. And what about, I had a question about this a while back, is bone spurs and arthritis. You hear of people that have bone spurs and arthritis, and their doctors are telling them you'll never get rid of arthritis or bone spurs in your back and you need surgery. Can you speak on that a little bit?
So you end up with arthritis and bone spurs. I mean, sometimes there's been a severe injury to an area, but even if there is some measure of injury or there is just no movement. I'm going to bring my little model back up here in a minute. This disc that's in between here is filled with fluid. That fluid pumps in and out. It's not the same fluid that was always there. It's always kind of recycled like everything else in our body. These bones moving around it are what make that fluid pump and cycle. So if these get locked and don't move anymore, that fluid doesn't do that. The disc starts to dry out a little bit. And then as it starts to dry out, it weakens. That's usually where bulging disc, herniated disc, that kind of stuff, or degenerative disc disease, I don't really think it's a disease, that's where that stuff starts to come from. But when I get in that situation, bones get inflamed. That's when I start to get bone spurs and arthritis in there. If you've got a significant spur, you may never get the whole thing to go away. But number one, if you get everything moving, it won't get any worse, and very often it will get much, much better. When I was 30 and went to my first upper cervical person, off of the fifth bone down at my neck, where's my camera? Right there. I had a gigantic, looked like a big eagle claw coming off the bone. To this day, I've been doing this a long time. I haven't seen anybody under 40 with a spur that big. If you look at that spur now, it's maybe a third of the size that it was then. I mean, it's greatly reduced, and I haven't built all that other arthritis. Wow. So are there cases where I tell someone, yeah, you need to go to the neurosurgeon? Sure. They come up. They don't come up that often, but I have kept countless people out of surgeries by correcting the function, and then you're able to heal up and do much better.
Yeah. Another question, Ingrid?
Yes. This is a two-part question.
Okay.
First part is, what are your thoughts on babies or children having regular upper cervical care? And the second question is regarding the gut. Have you seen upper cervical help with anaphylactic food allergies?
Okay, so let's answer first question first. I think every baby on the planet ought to be checked the second it comes out of it. You don't know what's happened in the womb, how it's laid, if it's a C-section or if they got to pull out either direction. You have a neck that has no strength, right? A baby can't hold their head up, so they don't have neck muscles to defend. So if I'm pulling and yanking and tugging or whatever I'm doing to try to get out of there, it's pretty easy to misalign those. And then as soon as a kid starts trying to crawl, starts trying to walk, they're falling all the time. And it would be much better to prevent those problems early, right? I wish to goodness I'd been adjusted when I was a baby. I would imagine when I was 30, my life wouldn't have been horrible. So I'm as big a fan as it can possibly be, because we're playing the game of prevention more than trying to clean up a big mess after it has occurred.
Wow.
And with this type of thing, it's super safe. If I've got a little baby, you barely even put your finger on it, almost vibrate it, and it goes right back in.
Wow.
It doesn't require, again, with an adult, it requires no force. With a baby, it requires almost nothing. And then I'll go to the food allergy side of things. And I'm going to use me as an example. Now, this is not an extreme example, as you're saying, anaphylactic of that, but when I was in high school, like any kid, I loved pizza, I loved lasagna, I loved everything like that. And suddenly I realized if I eat any sort of, like anything that had tomato paste in it, I'd be sick and thrown up for 3 days. I would break out in hives and feel awful. And then the list of food allergies just kept growing and growing and growing. And then I was getting to where I felt like, what can I eat? I got to have this tiny little straight thing with no seasonings, no flavor or anything, because I can't add anything to it. And I've got to, basically eat a potato and rice that came out of the ground. And once my neck got adjusted, I can pretty well eat anything I want. And I've had tons of patients like that over times. I mean, allergies are an allergy to something that I should be able to consume is an immune system problem, right? My immune system overreacts and freaks out. The nervous system controls the immune system, and those top bones being out of place will mess up the nervous system, thus mess up the immune system, and it kind of gets confused.
Yeah. Wow. Ingrid?
So the answer, I guess, is yes, but that's the longer version of why.
It's awesome.
Ready for the next one?
Yeah.
Yes.
I was diagnosed with arthritis in my C1 and C2. Can you still make an adjustment without harming the spine? If so, would the procedure have to be done on a continuous basis? I am not 100% sure of his diagnosis, but it's all I've got to go on. Could Raynaud's disease be misdiagnosed and it actually is a problem with the upper cervical?
So the arthritis part first, you certainly may have arthritis up there. Unless it is some rare, out of this world extreme condition, it's still fine to adjust. Most people, and especially as they get older, some measure of arthritis in the neck. I have a new imaging I've had the last couple of years. There's a lot more arthritis. Generally on a plain film x-ray, you don't see a lot of arthritis in those top two. I've come to realize I have like it's a CAT scan type thing now, that you see a lot more arthritis up there, but no, it's not a problem. It's not a contraindication. And the answer to, would it be ongoing? I mean, some level of maintenance, but everybody's a little different. Someone's stress levels in life will make a huge difference in how well they hold an adjustment and how well they don't. When I got out of school, in my little newbie brain, I thought, okay, if I get a young person that doesn't have a lot of arthritis or problems, they're going to hold an adjustment better than an older person. Well, the reality was a 30-year-old mom with 3 kids, and she's trying to work and deal with the household and all that stress, will throw their neck out much more than somebody that's retired, that kind of gets up in the morning and sort of does their own thing, right? They don't have all that pressure, tend to hold better. So stress levels make a big difference. Trauma history. If you've had a massive car accident where the ligaments up there got all beaten up, it may not hold as well. So that's a little more individual based upon that person's current and past life. And then the Raynaud's. I've had tons of patients with that. It may still technically appear as that, right? That vascular type change in problem. But I've had a ton of Raynaud's patients that you adjust them, and as long as they're in, that sort of disappears and doesn't show up anymore. Now, maybe they go out and it will pop back up a little bit, but as long as their neck is in alignment, they don't really have any trouble.
Yeah, that's crazy. You wouldn't think Raynaud's and upper cervical would have a correlation, but it's probably possible because again, it's everything runs through that brainstem, right? Your everything runs through.
If you keep in mind that your brainstem is the thing that keeps you alive and makes you function, right, and controls every function in your body, I'm almost a one-trick pony in the sense of the answer is, well, what if this brainstem? What if that brainstem? But it really is, it's just that vital.
Yeah, well, I even had one of my girls, I suggested they go to upper cervical in their area. This was a few months ago because she was doing everything right in her protocol. She was doing the intermittent fasting. She was eating right. And her blood sugars just they wouldn't go down. And we're like, maybe you have some hidden stressor, like maybe you have like a hidden stressor somewhere because the theory there, because when she went a few times, now her blood sugars were normal. So the theory there is, well, when your body's stressed out, so it's causing stress in her body, which is raising her cortisol, which was then raising her blood sugar, which is then raising her sugars. And so when she was just able to calm those nerves down via those adjustments, her blood sugar is regulated. Do you see that a lot happen with you?
Oh, absolutely. You'll see people some people get off everything. Some people have to stay on some things, but the big spikes and the swings and the inability sometimes to control it, it'll just level right out.
Yeah. What is the biggest healing you've seen through your patients? Like somebody that came in, I mean, you're your own testimony, but what's
the best story ever? Is that the question?
Yeah.
I think the best story ever was my first practice. I had a guy come in. The only reason he even came is that it happened to be the people that installed my x-ray unit were there in town. It was an old family friend. They were very big upper cervical believers, and they aggravated him to come in. But when he came in, he said, look, I'm here. He wasn't trying to be difficult, right? But he had been on a liver transplant list for 7-8 years or something. They had given him 6 months to live. They had tried everything. Every treatment there was, they finally said, there's nothing else we can do for you. You probably have about 6 months. Due to whatever, he never could move up the transplant list to get a new liver. And he said, you know what, I'm going to come to make them happy, but I'm at peace with it. My affairs are in order. He quit his job. He was just going to spend time with his wife and his kids and travel and do whatever. And I think he came in the office 3 times in that 6 months because, wasn't very motivated. He thinks he's going to die anyway. Why am I going to go full with that? I adjusted the top bone of his neck, forward right, I remember, 3 times in that whole time. On the transplant list, he was required every 6 months to go get his enzymes and liver tests and all that stuff done. He went back in 6 months. He got them all tested. Everything was 100% normal. And that was the end of it. They did that. I think they did that 2 more times. And finally they said, all right, fine. You no longer have liver disease. They took him off the transplant list. And that was the end of it.
And how long was that? Over a period of what time?
6 months.
Wow.
What point in there it all got better? I don't know, but 6 months is when they tested.
What do you think? Like, was the what part of the brainstem was being like? What was going on there? I can't even wrap my head around what that could have been.
What's my one-trick pony answer? Brainstem, right?
Yeah, right.
If the thing that sends information to the liver and from the liver back to the brain, if I've got a problem there and I'm not getting what I need, it starts to break down and not work right. And then you restore that communication, you restore the liver's getting what it needs, so to speak, and the brain knows what it needs and sends it, then it heals up and it works.
I mean, is your advice that everybody should go at least get a upper cervical consultation or get checked, no matter if you think it's out or not? Everybody should at least do it to see.
Yes. I mean, if it weren't for that, again, I would probably be in the mental hospital rolling in the wheelchair by now. I can't imagine where my world would be.
Well, and I also think most people think that just because they don't have a symptom maybe that's in their neck, right? They don't that they are okay. And I'm like you, it's like,
you got to lose that idea.
Right.
Because that's in reality, that's the small thinking. It's not the big thinking, right? The big thinking is, I want to make sure that my body, whatever I got, I can get the best out of it I can. Things are functioning as well as they possibly can. Am I promising if this is all clear, you're never going to have another problem in your life? No, but your chance to not have problems or to keep them under control is far greater.
Right, for sure. All right, Ingrid, do we have any other questions?
We do.
Okay.
My son is paralyzed from the chest down from a horrific dirt bike accident, thrown into the air, and the bike landed on his back. T567 is a cage. Would you be able to work on his neck?
Oh, absolutely. I've got a number of people that are paralyzed from one point down another. I've had quadriplegics. Yeah, without a doubt. And it's if you have that level of accident, the chances that something up here didn't get messed up are pretty low. So yeah, there's always accommodations you can make, right? Maybe I adjust them while they're sitting in their chair. You can do x-rays a different way, but you can always make it work.
Next question. How do you find a good upper cervical doctor?
So the biggest resource there is a website called, it's upcspine.com. You go on there, it has the people that, and I'll say this, the people that manage that, one of them has died, unfortunately, from an accident. But it's the biggest directory that there is, right? Anywhere around. I'm more than happy with you ladies that are on here. If it's where you are, or there's a family member you want to check out or something, shoot Miss Terry an email. She can send it to me and I'll be glad to look. I know a great deal of them. I've heard of a great deal more. And if I don't know who they are, I'll know somebody that does, and I can do a better vetting job. I mean, on average, any of them you go to, for the most part, are going to be very good. Junkie practitioners don't get into this kind of work. It takes too much. But that website is really the biggest online directory that you'll find, upcspine.com.
UPC Spine. I will put that in the show notes, everybody. Along with the recording of this show, I'll put that link in there in the show notes. Also, I do want to say that Dr. Engel has written a book. I don't know if you guys can see this. Dr. Engel, if they wanted to get your book, where could they go to get this?
Okay, book, you asked me, correct?
Yeah, if they want to get a copy of
Amazon.
Your book. Amazon.
On Amazon, you can get the physical copy like she has, and there's a Kindle version.
Okay, so you can go to Amazon and either type in Dr. Lee Engel or his book. It's really good, by the way. It's called My Dirty Little Secret. It talks about hormones. It talks about direct nerve pressure. It talks about your brain health. It talks about he gives a really good explanation of what upper cervical is, using like very descriptive stories and analogies. And I really liked it. It was really, really a good book. Also, Dr. Engel, I wanted to ask you about, there are different types of upper cervical,
Yes.
which gets very confusing. I was always told that the Blair technique, which is what you do, I heard that the Blair technique is the best. So could you say and explain why, and maybe touch on the other kinds of
I mean,
upper cervical?
I'm biased toward the Blair technique because that's the technique that got me well. The reality is, and again, you go back to practitioner skill level, right? If I take a very low skill level Blair practitioner, a very high skill level practitioner of a different technique, you're probably going to get better results with this. But the reality is we're all after the same thing. They're all very precise. They're all taking very specific x-rays and going through. Yes, if there was a Blair chiropractor nearby, that's certainly what I would choose, but I have been a patient because there hasn't always been another Blair chiropractor near me of their techniques. So I think as long as you can find somebody that's good, I would be more worried about making sure that area is adjusted and less, so to speak, about the technique.
Yeah. So like, so if they would go to that website, upcspine.com,
Yes.
and then Google their area. We have a lot of girls here from California. We have some from.
So when you go in there, across sort of a bar here, you'll see a little tab that says practitioners. When you click that, there will be a drop down. You'll click North America. Then there will be a drop down of states. So California is overran. It's a great place. There are a million upper cervical doctors in California.
Wow.
The listing is huge. So you just scroll down through, you'll see town. It'll say technique. Now, one thing, I'm going to say this because somebody asked me about it yesterday. It will say upper cervical certification up to date, and it won't say anything. That's not something they ever do. So ignore that. That doesn't mean somebody's not good. And it will also say takes precision x-rays on site. And a lot of times that says no. That's also not something they keep up with. I think it says no on mine. And I have the most advanced imaging unit on the coast of Florida. So ignore those two. But yeah, you'll go down through there. It'll give you name, website, address, and you can, find whoever's closer to you.
How have you heard of a lot of in Canada? Because I have a lot of Canadians on this call right now, and
There's a fair amount. Now,
Okay.
the technique, the NUCCA, N-U-C-C-A, is very big, and it's a great technique, very
Okay.
big in Canada. But yeah, and you can look on there. In North America, United States, Canada, and there will be a pretty big listing there.
yeah, I think I've been pushing, Blair technique because I'm biased
Sure.
because I've gone to only Blair technique. But hearing you say that, hey, if you can't find the Blair technique, find somebody. It's still better than nothing, right? Still better than going to a regular chiropractor.
Absolutely.
Yeah.
And I'll say this, if you're Canadian, I would look, because the predominant number of chiropractors in Canada, mostly because there's one guy up there who's trained a ton of them. He's great. Jeff Schulten. The NUCCA, I'll give you the website you can put on there.
Okay.
If I was in Canada, I would probably go look there first, because that's what so many of them are. You might be a little easier to find a listing, but you can also go to the other site as well.
Okay. Perfect. Ingrid, do you have any more questions? We'll take a couple more.
Yes, I have one more.
Okay.
I have herniated discs in my lower back that has caused nerve damage down my left leg and a tilted pelvis. I go to upper cervical, but sometimes wonder if it wouldn't hurt to go to an upper cervical adjustment and rotate with the other type of chiropractor. Do you feel that would be beneficial or not to do it?
I struggle to answer because things are case by case basis, right? Last year, so in April, I herniated my L5, and that was because I've done a lot of stupid things in my life, and I've done a lot of sports. I competed in powerlifting for many, many years, lots and lots of big, heavy squats and all. And finally, it was just, I'm getting old, and I didn't want to admit I was getting old, right? And I kept pushing and pushing, and I finally had a problem. But I have since that time had a few adjustments down there, but really it still falls upon whether my neck is aligned where it should be. Now, the one thing I will say, and what I think is probably better than getting adjusted down there, if you can find somebody in the area that does like myofascial release work, that has done more for that disc herniation when it was acute than anything else did, making sure my atlas was in place. And then I had that work done, because that tissue around there, especially in an area, so I'll do this really quick. Fascia is like, think about saran wrap wrapped around the muscle, the tissue, everything else. When something is injured and you have a trauma, it almost sucks in and grabs to try to protect it. But even then, when you get a little away from the acute, you still have all that tension and pull in there, and a good myofascial person will help to, it's like massage, but it's a little bit different, will help to release all that. That would almost be I would stick with the upper cervical and see if I could get that work done.
And let's talk about massage. Does massage go hand in hand with upper cervical adjustments? Are they a good match together to do at the same time?
I think so. You don't want anybody that's going to be doing great big neck stretches or really digging in up here, but the looser the muscles are, the better things will tend to behave. I mean, I've had some people, headaches are a great one. If they're chronically super tight up here in the shoulders, they seem to struggle to hold an adjustment. The headaches will get better, but not fully go away. You get somebody that's really good to loosen all that tissue and not have all the pull, and then they do a lot better.
Yeah, awesome. So any last word of advice that you can give these ladies that you can think of that would be helpful for them to know about upper cervical?
Go get it checked. I mean, really, it like Terry said earlier, right? There's always facets to everything. And I don't tell people necessarily they need to quit everything else that they do. But if you're having treatment or you're having a problem, whatever the thing is, if having that area clear, if it's clear, your chances of success, maybe of not having to do it, or at least of getting much better results, go way, way up if that area is clear. If that area's got pressure on it, the brainstem isn't functioning right, you're just running uphill through mud all the time when you're trying to clear anything else up. I'll use a quick analogy and then I'll be done answering. I've had a lot of autistic kids as patients over the years, and they do incredibly well. Now, I don't tell the parents to stop going to therapy because they still need the therapy, but they'll notice that as soon as that neck gets cleared out, maybe they were making this much progress a week before, and now they're making this much progress, right? It makes whatever you are already attempting to do much, much greater.
Yeah. Thank you. So informative, Dr. Engel. Seriously. you covered a lot of stuff. You answered a lot of the questions. And I know this was really helpful for a lot of ladies in here. A lot of them have been asking me, where do I find upper cervical? What do I do? So you've answered a lot of those questions. And to recap, you guys, if you want to get his book, you can go to Amazon. Also, in his book, he also does have kind of a good explanation of the different techniques. But I will also put in the show notes, I'll put the 2 links that he suggested, the UPC spine and then the NUCA. Did you say NUCA?
Yes, NUCCA.
Is that just nucca.com? Right? Is it nucca.com?
That's it, yeah.
Okay, yeah. So I'll post that too. And and then hopefully they will all y'all go and find an upper cervical in your area and go get checked, because you all need it. I know you do. And by the way, I get to see you on Friday, Dr. Engel. I'm so excited.
All right.
Because
and again, I'll say, if you have trouble finding somebody in your area or you just want to check them out, shoot Terry or shoot me an email and I'll be glad to look and answer.
Yeah, like you have so much extra time on your hands.
I'll make time.
You do. You're very good. I'm telling you. Well, thank you again, Dr. A. Appreciate your time so much. And
you're welcome. Thanks for having
me. I look forward to maybe doing it again down the road. But thank you so
Sure,
much.
anytime.
Okay.
Thanks.
Have a good day, y'all.
Bye.